Welcome to an interview with Mike, who discovered as an adult that many issues he had faced as a child and teenager, and still experiences to a degree, were caused by a tight frenulum. In those days, it was unusual for a tongue tie to be recognized, let alone to be released. But for many children and adults, this is still the case.
The actual idea of me being tongue-tied, never crossed my mind. It was actually when I was talking with you and you were giving me a bunch of different ideas of symptoms of being tongue-tied. And you're kind of listing them off. And I'm going, yeah, I had that, I have that, I have that. So it was really interesting because when I said, oh, well, why don't you check to see if I have it?
Yes.
And you said, okay, sure, open up your mouth, and you took a look and it's like, yep, you're tongue-tied. Like, I had no idea.
Wow. Now that you know about tongue tie having an effect on several different functions, such as, say, speech is one of the more common ones. Did you encounter that in your life? Any speech problems?
Yeah, see, probably that was the one that triggered it the most for me.
Yes.
Because when you said about having a speech impediment, I went back to my childhood, and I had a huge one. Actually, I was looking at my my report card the other day at grade 1, and the teacher had said, oh yeah, he's a very nice kid, except I can't understand him.
Oh, grade 1.
Yeah.
Wow.
So then I remember my parents, they took me to speech therapy, and I remember having to do all the drills and do everything that, to get my R's going and that type of stuff. And I'm sure it must have helped, and eventually I grew out of it a bit more.
Yes.
But definitely at that time, I had it. And if I would have known at that time, then of course I'm sure my parents would have done something about it.
Yes, yes.
But it wasn't until a neighbor of mine said, because he wasn't really answering, and she goes, have you ever had his ears checked?
Oh, yes.
I never thought about being deaf or anything. And so we had that checked.
Yes.
And then they said, okay, maybe you should have him take speech therapy.
So do you remember any of the particular things you had to do, like the homework for the speech therapy with Mike?
Yes. One of them was to, with his tongue, paint the roof of his mouth.
Oh, yes.
And so, of course, we would do that. We had it where if he misspoke a word,
yes,
then I was told, don't you say the word and then he copies it, because then he's parroting you.
Right.
So you just get him to say the word again. And I had quite a chuckle one day, train, and what was the word? And then he goes, locomotive. Oh. And
very
thought,
smart.
Okay.
The TH was a big one. It was more coming out as an F
Oh,
than
yes.
the TH.
Yes.
And it really wasn't until I was in university, and one of the courses we had to take was a speech course
Yes.
for learning how to, let's say, broadcast or talk on the radio.
Yes.
And we spent a whole year doing that. I hated it, because I hated the whole aspect of learning how to properly speak.
Oh.
Right.
Yes.
But I think a lot of that came from not wanting to, I guess, let a lot of people know that I had a speech impediment. So it was easier not to speak up in class. It was easier, not to do speeches. And it's interesting because actually, when I think about it, my mom would sometimes ask my sisters to explain what I said, because they understood me because they were with me all the time.
Oh, yes.
Right? So definitely it was an issue growing up.
Yes. For some years after that?
Oh yeah.
Yeah.
Yeah. I remember even in junior high, right, I was very conscious of it.
Yes.
Yeah.
How did it affect you, sort of emotionally or socially?
I guess I can speak from the side of you're way more introverted. Like, I'm not going to offer to talk when we're meeting new people.
Yeah.
I'm not out there, starting up conversations.
Yeah.
I'll wait for that to happen and
Yes.
then work it from there.
Yes.
But definitely growing up, I would shy away from getting to know new people.
Did you? Yeah.
Yeah.
Yeah. And it focused in your mind that it was because you felt your speech wasn't perfect.
Oh,
Yeah.
hands down.
Yeah.
Because what's the worst thing, right? That they make fun of you
Yeah.
because you have a speech impediment.
That is more common in boys.
Is it?
Yeah.
Oh,
Mhm.
okay.
Yeah.
Well, and one of the things that I found out afterwards was quite often it's detected through breastfeeding.
Yes, that's right.
And
Yes.
I wasn't. And, that's also probably a reason why it wasn't detected.
Right. It is often missed. It's very commonly missed in babies who are having breastfeeding problems, let alone with children who are having speech problems. One of the big problems I've noticed in adults who've had a tongue tie all their life is when they look back, they find there have been dental problems, and the kind of problems that occur due to the limitation of the tongue movement is that the palate doesn't widen out. It can be quite narrow, and therefore the teeth are crowded. And so that's one of the big problems. Another one is that when a tongue is severely tied, the person can't lick the outside of their molars, either top or bottom, to clean them, because a lot of what we do unconsciously after we've eaten is we clean our teeth with our tongue all the time, you know. So, so quite often people have had to have some orthodontic treatment, either because of crowding or a very high palate. So did you run into anything like that?
Because all these things, to me, just seem normal. I never put two to two together.
Yes.
Right? So what's interesting to me is I had braces, but I have a very small upper
Jaw?
jaw.
Yes.
And I had 2 teeth pulled just before I had braces. They pulled a couple of teeth because they had to have enough room
Right.
for the teeth I had.
Right.
So actually right now, and they are a little bit tight, but now I'm already 2 less teeth than other people have.
Oh, right. Ideally, it stays wide, and it's partly the movement of the tongue and the mobility of the tongue that allows, that helps form the bones, actually, of the upper jaw and the roof of the mouth. By moving and flattening out and pressing as a wide tongue. When you have the tongue tie, you don't have the full movement of the tongue. It doesn't have that flexibility, and the palate tends to narrow, or the roof of the mouth tends to narrow and also become higher inside, like not wide like this.
Yeah.
And then you tend to have more of a narrow smile.
You know, I don't know if it's normal for people to bite their tongue. You know, like how often should somebody bite their tongue?
I think it's not a common thing. Just,
Oh, really?
Yeah, I mean, I think most people have done it,
Yeah.
but probably just a
Yeah.
few times.
Yeah.
Do you find that's a
Yeah,
problem?
and what's interesting, because and now of course I'm really concentrating on it, right?
Yeah.
You know, that my tongue definitely gets in the way of my bite.
Is it the sides of the tongue or the front?
No,
Do
the
you know?
sides.
The sides, yes. Possibly because of the narrow-ish upper jaw.
Yeah.
Probably.
Well, and here's something else, and I don't know if this is going to happen when you actually do the procedure on me,
Yeah.
but my gag reflex is huge. Like going to the dentist is like, you know, I just dread it because, you know, any object in my mouth, you
Yes.
put a couple of fingers in my mouth and my gag reflex is there. Mm-hmm. You know, I wonder if that could have anything to do with it.
Possibly. Yeah, because the whole mouth is affected by the tongue tie, and the back of the tongue can tend to bunch up. So that could be one reason why a person has an increased gag reflex.
Okay.
Yes.
I don't know, you know, what's normal for other people.
Right.
And that's why so many of these aspects within tongue tie is interesting to me, because what I think is normal
Yes.
maybe wasn't if I would have had the operation as a kid,
Yes.
right?
And some of these things are normal for people without a tongue tie, of course.
Yeah.
But they're probably increased
Yeah.
likelihood
Yeah.
if you do have a tongue tie. Now, there's certain sleep problems that are quite common in society, but they're more common in people who have a tongue tie, as an adult, throughout their life and as an adult, such as snoring and even sleep apnea. That's where you actually stop breathing for a short time, and then suddenly, gasp and draw in a lot of air.
Yeah.
Do you have anything like that?
It's interesting because I do snore, so I figure that's fairly normal. But yeah,
Absolutely.
I am a snorer. And when I was talking to my wife about this the other day,
Yes.
I was saying, well, yeah, we both know I snore, but I don't stop breathing.
Right.
And then she looks at me and says, well, no, you do.
I see. Right.
So
Yeah.
it's like, well, what do you mean? It's like, no, like I'll actually
Yeah.
stop and then I'll gasp
Yes.
and then start again.
Yes.
So I never knew that until like a week ago that I
Right.
actually did that.
Right. Right.
Right. So yeah, so it is interesting.
It is. Yes. Now, we can't say for sure it's because of the tongue tie, but as I say, it's more common amongst people with a tongue tie, just
Yeah.
because of how it's affected the structure of the mouth and throat. So, Mike, although your speech is great now, sometimes people will have they have to make more effort to speak than the average person if they have a tongue tie, and therefore can get quite fatigued if they have to speak a lot at work or something, or give talks. Do you think at the end of a day you might find anything, in terms of fatigue or?
So what I'll do is I'll find at the end of the day, if I've been doing a lot of talking in that day,
Yes.
my mouth will be tired.
Yes.
And people have told me that it can be noticeable that I'm struggling to work for words.
Oh, yes. Yes.
And it's interesting because as we sit now, it's already 7 o'clock at night.
Yeah.
And I can already feel within my mouth that it's not as elastic. It's
Is
not
that
as
right?
punchy, yeah.
Just about all the symptoms you've had and do have, they do exist in other people, but they're much more common in someone with a tongue tie. Yeah. Tongue-tied adults experience oral fatigue after prolonged speaking. Also, tongue-tied babies have oral strain with long nursing. Well, I see that with tongue-tied babies breastfeeding. The mum may have no idea why. She feels everything's her fault. Often babies cannot maintain sucking for long enough to gain sufficient weight. That frenulum, the tongue tie, the membrane under the tongue that's been preventing movement, sometimes it starts to ache a bit. And another thing it can do is, if you do push your tongue out, it can scrape against your lower front teeth.
Yeah.
Are you aware of anything like that?
I definitely have enough times where it does hurt, and I don't mean hurt as in like ow pain.
No.
But I can feel it. I can feel that stretched. I can feel that it was extended
Yes.
for any period of time. Like
Yeah.
absolutely, I can feel that.
Yes. Yes. What's in your mind? What are you hoping for? And why would you like to have it released now at this point?
Yeah. I do want to see what difference it does make.
Yes.
I do absolutely believe that my speech impediment as the main one, growing up, was because of my tongue tie.
Yes.
And now, if I do get it snipped, I want to see if that does make a difference.
Yes.
And if it does, then it'll be really curious just in my own personal journey
Yes.
to know, okay, you know what? That is why that happened in the past.
Yes.
Right? I'm
Yes.
really curious whether or not it is going to make a difference.
Yes, yes.
And the symptoms that I do have, the tiredness of my mouth at night,
Yes.
you know, the frenulum, that it does hurt occasionally,
Yes.
and also just whether or not my speech actually maybe gets a little bit better.
Yes. So overall, what do you feel the impact of this has been on your quality of life, looking from, you know, early childhood to
Yeah.
now?
You know, if it would have been snipped as a child,
Yeah.
so it would have been diagnosed as tongue-tied, and I would have had the simple procedure,
Yes.
and if that would have fixed my speech impediment,
Yeah.
absolutely I would have had a different childhood.
Would you? Yeah.
And I think that's the underlying goal, right? Is just to educate people so that they do a quick check,
Yes.
find out.
Yes. So Mike, first we'll just spray with this lidocaine, common dental spray. It's what they always use in dentistry. Quite effective. Two or three sprays does wonders. And then I use the smallest scissor. Can either be a curved iris or a straight iris, just a very small scissor. And gauze in case of a little bit of bleeding. And I keep these on the tray. This is silver nitrate, a little bit on these sticks. They look like matchsticks. That's for excess bleeding. I have never needed to use them, but I keep them on the tray just in case. And then a pair of gloves. So first I'm just going to look at the dental arch here. It is in fact rather narrow. A high palate here, the roof of the mouth is quite high, especially in the centre front here, which is typical. There is slight notching of the tongue, indicating restriction by the frenulum. So there is the frenulum there, and thin and very easy to snip. There is here, at this point, what we call an epithelioma. That is that little sort of lump on the frenulum, and that results from the frenulum having scraped against the lower front teeth. A little bit of an injury where the body's been trying to make up for the little, probably quite light, small scrapes that occur. There might be some thickening at the back of the tongue due to the tongue having had to work harder during its lifetime. So now I'm just going to spray on here, so you might feel some coldness. I am elevating the tongue in order to visualize the frenulum. I am going to perform a conservative snip first and follow with a further small cut when I can see the remainder clearly. I'll give you some either Tylenol or Advil to take home with you. Avoid acid foods like any kind of citrus, lemon, orange, pineapple, vinegar will sting it for the first few days, so just avoid those kind of foods.